Good evening, everybody, and welcome to the special edition of Wednesday Night at the Lab. Before I introduce our special guest tonight and the talk that he will be presenting tonight, I would like to invite everyone to attend many great events that will be happening this weekend throughout UW campus. To mark our 175th anniversary, the UW will be hosting events on this campus and across the state through May 2024, with the main ones happening this weekend, Friday through Sunday. At the same time, we will be hosting the 22nd annual UW Science Expeditions again this weekend, Friday through Sunday. The Saturday events will be mainly held on the central campus, while the Sunday events will be on the west side of campus. We'll focus on health and biomedical sciences at the School of Medicine and Public Health. For more information and to see the calendar of events, you can visit 175.wisc.edu and science.wisc.edu. And now back to our special guest tonight. Our speaker comes from the Universidad Ana G. Méndez and is one of our collaborators on the UW Graduate School Partnership Program in Graduate Excellence. This is the award that the Neuroscience Training Program received from the Dean Karpus's office last year. This project is also co-sponsored by the Office of Dr. Laura Knoll, who is the School of Medicine and Public Health Associate Dean for Public Research Training, for Basic Research Training, excuse me. This collaborative project is to promote scientific collaboration, develop new science outreach workshops, create opportunities for scholarly visits for faculty and students, recruit postbac and graduate students to UW-Madison, specifically from Hispanic serving institutions in Puerto Rico, such as Universidad Ana G. Méndez. Dr. Malave-Llamas has a bachelor's degree in microbiology, master's degree in environmental health, and a PhD in environmental sciences. In 2004, he left his job at the Puerto Rico Department of Health as an environmental health specialist in order to join the School of Sciences and Technology at Universidad Ana G. Méndez. He began at Universidad Ana G. Méndez in an administrative position and as an academic executive director of the federal grant prize, which was sponsored by National Institute of Health. During the pandemic from 2020 to 2022, he served as the Dean of the Academic Division of Science and Technology by managing to advance the academic and professional agenda of the division. Currently, Dr. Malave-Llamas is an associate professor and principal investigator of an NSF grant that supports the academic journey of STEM students through research. Dr. Malave-Llamas also has a genuine interest in studying and protecting our natural resources and environment. He directs several research projects in bioremediation, water quality, climate change, environmental microbiology, and environmental risk assessments. Through his research and teaching, his students are educated in the importance and relationship between environmental health and human health. In his words, our health is a reflection of environmental health. And will that please welcome Dr. Karlo Malave-Llamas in presenting today his talk.
Thank you so much for the kind introduction. Hello, everyone. I'm going to talk to you about the importance of water monitoring programs and how they can be a public health tool for protecting, public health in my case, in my island. The objectives of this talk is to make people understand the importance of water monitoring programs, what's the importance of water quality and how the water quality impacts health, and how recreational waters are being impacted by different pathogens and what we can do as individuals to protect our resources. Keywords here: water quality, public health, microbiology, bacteriology, balnearios, which is public beaches guarded by the state in the, or the island in my case, antibiotics, Vibrio, and unmonitored and monitored bacteria. Let's talk about water. Many of you maybe know, but water is a compound. It composed of two elements. The characteristic of water and the things that water have that got interesting for me is that as such a simple molecule is so important for life on the planet. Every process, metabolic process we have in our bodies depends on water. How nutrients enter the cell, how nutrients are dissolved, how our electroreceptors, the processes we do and have in our bodies are dependent on water. So if so necessary for our well-being, we must protect it. We have several ways of protecting our water bodies. One is the Clean Water Act. The Clean Water Act in different instances has been attacked or tried to change it a little bit for different reasons, but the Clean Water Act is from the 70s, and what the act pretends is to make the state do everything possible to protect our waterways. And in your case, for example, it's very interesting. I was talking to Anna and telling her that potable water is a very important resource, And here in the United States, you have 25% of the potable water easily accessible in the Great Lakes. 25% of all the water in the planet, you have it here in the Great Lakes. The water in the sea, you have to get out, get out the salt. The water in the poles, you have to melt it. But in the Great Lakes, it's accessible. The EPA has several water standards, and those water standards go from bacteriology to chemical factors, how taste, smell, pH, and different characteristics that the water has to have. And those are pH, dissolved oxygen, turbidity, temperature, salinity, nutrient, herbicides, for example, bacteria, viruses, protozoa, biological oxygen demand, color, taste, and smell. I'm going to concentrate in bacteriology in this case. Now, another of the words that you see in my title highlighted in green was public health. What is public health? Public health is a very important and awesome tool to protect the health of a community or a nation from all the perspectives we have to take into consideration. A doctor takes one perspective, a nurse takes one perspective, a toxicologist takes one perspective. But when you work with public health, you have to take all perspectives to protect that community. And what public health wants to do is to preserve and enhance individuals and community health. To accomplish this effort, healthy lifestyles are encouraged. Illness and injury prevention research is conducted, and infection or chronic diseases detection, prevention, and responses are studied. And under the big umbrella of public health, you have biomedicine, environmental health, epidemiology, anthropology, biostatistics, big data. You have a lot of other sciences that get into the public health umbrella to have the outcome we want, that is protecting the public health. Okay? Now, what are beaches? We have many, many definitions of beaches. And for example, people in Chicago have a definition of beaches that doesn't agree with me. I have no pun intended, but beaches are like this. Have salty water, have sand, have palm trees, and people are drawn to them. But there are two types of beaches. Beaches that are open to the public without any amenities, and beaches that have amenities. For example, bathrooms, places to have barbecues, for example, and that's what we call balnearios. These are beaches. And I'm sorry, I know the weather we are having here, but 3 of those pictures I took on Saturday. No pun intended, I'm sorry. These are beaches. So I show you beaches in Puerto Rico. This one is in Hawaii. And I took all these pictures, and this is in Florida. Now, what is environmental monitoring? The EPA has a environmental monitoring program and has different ways of monitoring bacteriology in the balnearios. For example, they concentrate on fecal coliforms, and enterococci. Those are the things they are looking for. Why? They are looking for that because they are indicators of fecal matter, human fecal matter in that water resource. And that's perfect. That's great. But there are a lot of other bacteria that could harm our health and are not being monitored. So if I don't monitor them, I don't know if they are there. And people can be harmed. This is in the island, this is how the program works. We have 52 beaches that are monitored across the island, at balnearios, every one of them. And our parameters are there. We look for enterococci, 70 CFU. Here in the States, 35. And there's an explanation for that. I'm going to tell you in a few. And fecal coliforms that are the same as here in the state, that is 200 CFU per 100 milliliters. Why enterococci is double here that in Puerto Rico than here? I'm sorry. Why they're double in Puerto Rico than here 35. It's because our island has a lot of mountains and we have a lot of rain. And when rain, a difference that we see in the States, when in Puerto Rico rain, runoff bring a lot of nutrients to rivers and balnearios. And nutrients make bacteriology grow. So since we are a tropical island and we have 2 seasons, rainy season and more rainy season. Those are our 2 seasons. So it's raining all the time in the island. So that's the explanation for that. The local newspapers take into consideration, I'm sorry that it's not translated, but the local newspaper take into consideration that it's very important. The health of our balnearios is very important for us in the island. And as you see before, every green flag there says it's okay. Okay? The local newspapers tell the public, the local public, if you can go and bathe in the beaches. Okay? And in the agencies, the EPA, the Department of Natural Resources, and in every beach, you can see an announcement like this. This beach is apt to bathe and to be, or is not apt to be. Now, what's the invisible problem? The invisible problem we have is unmonitored bacteria. And in this case, in my case, my interest is Vibrio. We and some of my students back there work specifically with 3 Vibrio species: Vibrio cholera, Vibrio parahemolyticus, and Vibrio vulnificus. Those are the 3 that we're looking for. And we have found all 3 in the island in different quantities, cholera being the most we have found in the island in different scenarios. But Vibrio is a bacteria, its shape has a curve, has only 1 flagella, and it grows perfectly yellow in TCBS. So every point, every dot you see there that is yellow is presumptively a Vibrio, because you have to do a molecular test to be certain. But presumably, it's Vibrio. We monitor water in the same places that EPA does. We monitor water, we monitor sand, and interesting, in sand, the quantity of enterococci and Vibrio is higher than in the water. And we monitor bivalves, almejas, ostras, oysters, thank you so much. Gracias. Oysters. So when you have unmonitored bacteria, as I told you before, you can have an invisible problem. You don't see what's there. And many of the infections that you can get from Vibrio are very mild. The Vibrio cholera that we see in, for example, in Dominican Republic, in Haiti, that is terrible, is specifically O1. Not necessarily all Vibrio will have the same effect, but many Vibrio species can cause you mild effects, and in the majority of cases, people dismiss them as that's a stomach flu. You have nothing, don't worry about it. It will go in a few days. So we don't have a record of the possible infections we have in the island. Now, why is this important? In the US, including Puerto Rico, there's almost 80,000 illnesses each year in the US by Vibrio, for example. The most reported is Vibrio parahemolyticus. I told you that was one of the species I monitor. Why? Because it's related to food. That's the one you will find very often in oysters. And it's the only one that is monitored by the FDA after you get sick, because it's in food, as the FDA monitor food. But the problem is that if the oysters are filter feeders, why don't you monitor the water and don't wait for people to get sick? If I know there's in the water, the possibility of people eating oysters, raw oysters, and getting the bacteria is very probable, right? I like prevention a lot. Another problem is the ones that like environmental health, for example, or environmental sciences. Vibrio has been linked to coral bleaching, some species of Vibrio. And with global warming and climate change, the temperature of water is rising, and more Vibrio are in water that is hotter. In the island, I measure the temperature. The thing is that we don't see a big difference because we're on the tropics. But I'm going to show you a recent paper of Vibrio vulnificus that you will remember what that is in a few, in the East Coast of the United States. And more or less from 2010 to 2018, the infections of Vibrio vulnificus has skyrocketed. And since it's not monitored, People know about it when when patients get into the hospital. And Vibrio vulnificus is the one that necrotizes the tissue. When you see, for example, in Florida, another flesh-eating bacteria got a bather it's Vibrio vulnificus. So it's becoming an increasing problem that is invisible because unless you see or read a paper about it, a published paper, okay? You won't learn about it. Okay? And there's another paper that was done in Florida, and with the Sahara dust bring a lot of nutrients. And when you see Sahara storms, Vibrio increases. That's another factor that affects the island. This is the paper I was talking to you about. Every purple dot is an infection of Vibrio vulnificus and is related to climate change. I just put this image from the paper in this presentation for time's sake. But if you read the paper entirely, you see that they are also measuring the temperature of the water. And as the water temperature increases, the Vibrio infections have been increasing also. Now, what I do, research. I have with some of my students here, some that have graduated already. What I do, I monitor 9 balnearios across the island. Okay? Those are public balnearios. They have lifeguards. They have places to eat. They have playgrounds for kids. They have parking. They have parking. So they are places that invite people in. So people go in a lot of numbers to those balnearios specifically. My students help me take the samples, water and sand in this case. It has been difficult to take bivalves because the fisherman tell me, what are you going to do? You're going to close my kiosquito, you know, my vendor area. No. It's very difficult to convince them, but I have data from one year, 2019 specifically. We go to the lab and we process the samples. It's a simple filtration method. And incubation, and that's what you get. Everything that is pink is coliforms. Everything that is yellow here is Vibrio. We identify them by Biolog. Biolog is I don't know if you know about it, but Biolog is a very good standardized method, phenotypic method of identifying bacteria by genus and species. Very fast, very cool to use it. Very convenient. And then we did antibiotic resistance to those samples. This is what the apparatus gave me. And as you can see, give you the species, genus and species. And these are the Vibrio we have been getting, a lot of them. And these are the other bacteria, enterobacteria, that we have been getting in the samplings we do. Now, why I'm picking up enterococci and fecal coliforms? Because those are the ones that are mandated by law and are in the monitoring program. And I want to show them that Vibrio is present the majority of all of the time or all of the time when enterococci is high. And I have been proving that. Since 2014, Vibrio is the one in blue, Enterococcus is the one in red. Almost is equal. So enterococci could be an indicator of Vibrio. So when you close the beach, because there are high enterococcus content, there possibly there high Vibrio content also in the beach. Okay? This is the same graph, just enterococci and Vibrio, taking away the other bacteria. In sand, it's almost the same. So when in the island they close the beach and they tell you you cannot go into the water, but keep playing here, the problem is still there. Right? So telling the people don't go into the water, don't solve the problem, or don't protect necessarily public health. That is what you want to do when you close the beach. Right? This is the same without the other bacteria, and this is in bivalves. This is just 1 year, because I told you that the fishermen, because I wanted oysters from Puerto Rico fresh. I don't want to go to Sam's or Costco to find it. I need them fresh. And it was very difficult to convince this specifically fisherman to give me the oysters, to sell me the oysters when I told him what I was going to do with them. Okay, so the quantities are very, very similar. Again, and hot sauce and lemon doesn't kill them, please. People say just put lemon on it. Don't know, no, that doesn't work. Now, what beach has been in compliance? I have the 9 beaches here, and whatever is in green is in compliance. So in the majority of cases, the beaches we have been monitoring are in compliance with the standards. But there's a few of them that have been not. Now, when we took this, more than 1,000 samples, specific bacteria, and exposed them to common antibiotics, for example, these are the patterns of resistance or susceptibility to the antibiotics. And as we can see, tetracycline, penicillin, and streptomycin don't work. That's common knowledge, that those antibiotics are not working as they used to be. Okay. This research has been published in several papers with my students having been the first author in some of them, and have been presented in different congresses, ABRACAM, SAGNAS, and other ones. This was SAGNAS in Hawaii. That's where I took the picture that I show you. It was presented in the Department of Education also, by invitation also. And in ASM, I was sponsored by ASM to go and present this work. It had been presented across the nation. And what is the main message that I want to give you is that monitoring programs work, are a public health tool, should be more open to include other kinds of microorganisms. In this case, I'm proposing Vibrio is added to that, the law that the monitoring program monitors Vibrio. And what's next in my case? I need, or I have a lot of samples in my freezer. I need to do a sequencing on those bacteria, and I want to find out specifically what virulence factors those bacteria have to see the real risk of a public health problem. Final thoughts. There's a lot of factors. Turbidity, for example, is a big factor in that enable organisms to thrive and to not be detected. I want the Department of Natural Resources in the island to add Vibrio to their monitoring program, also the EPA, and to take into consideration that the topography of the island and the zip code of the island make it different than here in the nation for precipitation patterns, topography, and those factors have to be taken into consideration at the time to put regulations. And when I get here, I love this poster. When I get here in the airport, I saw this, we are all on clean water. This is here in Wisconsin. I saw that and I have to take a picture. I'm also for clean water. It's the only common denominator as a food. It's the only food that we all have to get. Maybe some of you eat sushi, some of you are vegan, some of you are meat eaters, but all of us are water drinkers in different quantities. So water is. For the next generation, for my students, and for the students that are watching me in Zoom and students that are here, we are all students all the time. I have a friendly advice. First, have autodetermination. We need you. We need people younger. We need people that continue the legacy that we're trying to leave. So we need you. Be focused, be determined, have passion, work hard, and do something for your nation. Leave a legacy, please. Have fun. I'm in only one of those pictures, but every picture I have taken. Have fun, and I love water. Have fun. Have fun. I know we have to work hard, but have a little fun. Find a good mentor. Find a great mentor, please. And be a great mentor. Okay? And know your strengths and opportunities in the right environment. There are no limits, and you always rise. So with this, I finished. Any questions? Questions? Yes.
For stopping or limiting human pollution of a given beach, how long does it take for that water or sand to have a significant drop in Vibrio, coliform, or other bacteria of health concern?
We have seen in some of the beaches that we work with within a week, we have seen significant dropouts if there are not other external factors like rain, for example. Rain is a big problem because we can have pollution in the mountains, for example, and I don't see it in the beach, and when it rains, but if everything is perfect, we have done monitoring weekly and we have seen a dropout.
Fish coming in the rain.
Yeah. We can have cattle, we can have landfills, legal and illegal. We can have we have areas where we farming, for example, coffee. the nutrients, the fertilizer, that's the word. Thank you. If the beach has more than 70 CFUs of enterococcus, is in not compliance.
So they are closing at that point?
Yeah.
But they're not compliant.
Yeah, see, if it's had more than 70 CFU of enterococcus, it's not in compliance, and the beach is either closed or they tell you cannot go into the water. Mm-hmm.
Puerto Rico has a lot of hurricanes.
Yeah.
How does that affect the water?
It's a big problem. We have a big problem with that. So, but if we will have our ecosystem pristine or in good condition, even the rain, even the hurricanes wouldn't affect it as much as if we have contaminants or anthropogenic impact in mountains, in illegal landfills, for example. But the hurricanes affect, obviously. Did I answer your question or no? Sort of. But you can ask me again. Yeah.
If pedophiles or tolerant salt, do they spread in ocean water from island to island?
That will be a great research to see, because, for example, we have seen differences in Vibrio in the north side of the island and in the south part of the island. We have seen, yeah, exactly. But it will be interesting to compare, for example, Vibrios on Florida and Vibrios in Puerto Rico, Vibrios in Dominican Republic and Vibrios in Puerto Rico. It will be very interesting. I will gladly do it with funding. Yeah, I know. Vibrio doesn't like fresh water. It needs some quantity of salt. Vibrio are either allophilic or allotolerant.
Survive that. Get it.
No. Vibrio is an inhabitant of beaches.
But you got beach. It's gonna have close to 4.
No. What got through some agricultural source is nutrients. If I had Vibrio in the beaches and nutrients get into the beaches, then Vibrio spikes. We don't have Vibrio upstream.
So they're actually
Exactly. And in a good healthy quantity, Vibrio has its place. The problem is when nutrients are high and the population start growing out of control. Every beach has Vibrio. The problem is the species and the quantity.
Because you mentioned that enterococcus would be an indicator for Vibrio. So then, enterococcus could come with a run.
Yes.
And that will potentially help, could be like an antivirus speech. Then helping grow.
Yes. Completely agree. Yes. How higher, what? We got it's very easy. We go and pick off different quantities of sand. In my case, I pick 1 gram. 1 gram of sand, I put it in sterile water. I resuspend the bacteria, and the water I filter. Yeah, but the thing is that the monitoring program doesn't monitor sand. I do it. So they don't know, they don't care. I don't, for another word, they know because the law doesn't oblige them to do it. They are not mandated by law. And since they will cost, because having a monitor another environment will increase the cost of the agency. That the problem principally for all this is money. It's money. I do it because there's a lot of research papers that indicate that bacteria could be present in the sand, especially the sand that get wet. Not the super dry sand, but where the beach line gets, that's what the sand I get. And it's very high in enterococci and Vibrio. How the what? I don't know. I don't know, because we have bioluminescent base, but it's not by Vibrio, although there are Vibrio species that are bioluminescent and are in association with some shrimps and some fishes specifically. But the bioluminescence in the island, in the three main parts of the islands, is by a dinoflagellate. It's not a bacteria. But if they're affecting, I don't know. But that's a good question. Another question? It prefers a hot and salty. That's the way Vibrio works. That's why they have been seeing Vibrio volnificus in higher parts in the States, because the water temperature has been increasing. I have not seen that in a significant way, because our water is always hot. So I can see a 0.1 degree change or 0.2 degree change. But in the States, from Florida to New York, for example, you can see change, a big change. And when you start watching the water temperature from 10 years ago to now, you can see a big change. And Vibrio vulnificus is evidence of that water temperature change, because they like warm and salty. Another question? I love to talk about this, so even in English, that is difficult.
Well, no more questions. Thank you so much.
Thank you.
Thank you, everybody, for coming too.
Anytime, anytime. I feel very welcome here. Anytime you invite me.